Hour number 2 of the GD Morning Show from the Ireland Contracting Studio, 1-800-NEW-ROOF, IrelandContracting.com. The show built by Ireland Contracting. He is the G, I am the D. Greg Maxwell, Daryl Grandy, GD Morning Show, talking Pittsburgh 1320 WJAS. And how often is it we get to have a guest in studio joining us right now?
Yes, and how often is it that once you reach a certain age,
yes,
you start getting back pain?
You do get back pain.
And what do you do about it?
And what do you do? And so many options out there. And it's so funny because in this job that we do this radio stuff, right? And this is very oral medium. We hear a lot of we hear voices, and rare is it that we actually get the opportunity to take a voice we hear so often and put a face to it and put an actual presence to it. We've heard this guy for years. We've heard you on the air for years. You've been on the air. You've been out and about. You've been here. You've been there. You've been on TV. You've been on WPXI. You've been doing other radio stations around. Not even ones in this building. We're not supposed to talk about them, but you've been on there as well. Now we get to meet you here in the present, in our right in front of our faces, Dr. Pete Peduzzi, American Back Centers. Welcome to the GD Morning Show.
Well, thanks for having me.
And AmericanBackCenters.com. Let's get the particulars out of the way. 724-935-3300. 724-935-3300. AmericanBackCenters.com. Welcome. You're here to record. You're here to talk to us about what you do at American Back Centers. First off, we've never met you before. Who are you, and what do you do? What do you specialize in American Back Centers? In Pete Peduzzi's own words, who is Pete Peduzzi?
Well, thank you. I'm Dr. Pete Peduzzi, the owner of the American Back Centers. We're located in Wexford, and we have a disc specialty center. We specialize in treating some of the most difficult cases.
Sure.
Herniated disc, bulging disc, sciatica, spinal stenosis, and even failed spinal surgery.
Wow. So when you talk when it comes to back pain, there's no such thing as too old or you have to be a certain kind of person, or back pain, that's not for me. Back pain affects all of us, does it not? The things you do at American Back Centers, they help everybody.
Yeah, we've seen patients as young as 16, and we've seen patients. We currently have a patient who's 99 years old.
Really?
And a lot of it has to do with the state of their condition, the complicating factors, and so on. But we've seen some of the most difficult cases. Now, we can't help everybody, but we've helped the majority of the people. In fact, we have a 92% success rate if accepted for care with this exciting treatment. So
there has to be a little bit of a pre-vetting before being treated by American Back Centers.
Oh, sure. We do a detailed, complex, comprehensive physical examination history. In many cases, we require an X-ray or an MRI to truly diagnose the condition.
Okay, now before we get into what you guys do at American Back Center, what are some of the other treatments, therapies available, and why might they not necessarily work as well as what you guys do?
Well, there's a lot of what we would call so-called decompression devices out there that are really just glorified traction devices. And if you look at the research published in the Journal of Neurosurgery by Ramos and Martin, 2 neurosurgeons, this research was only done on VAX-D. And this research shows that VAX-D actually does what it says or claims to do, creating negative pressure, forming a vacuum, not just stretching the body apart like some of these so-called decompression traction devices. We have the proof that what we say is actually occurring. And this is verified by research published in a peer-reviewed medical journal. No one else has that.
Sure. So VAX-D, that's what this is all about, right? VAX-D, that's the star of the hour here for American Back Centers. VAX-D is what you specialize in: VAX-D therapy, VAX-D treatment. What is at its core VAX-D? You mentioned vacuum earlier. Is that the crux of VAX-D? Is that the VAX in VAX-D?
Well, when you typically try to separate the spine, stretch the spine with traction, there's a reflex muscle spasm that occurs that protects the body.
Sure.
Somehow, through the engineers and doctors and all the technicians went into the invention of the VAX-D, and Dr. Alan Dyer, the former Deputy Minister of Health, actually invented the VAX-D. He himself had a disc problem.
Sure.
He was a Deputy Minister of Health of Canada, PhD, MD, and put it on the market in Canada. Some of the Canadian hockey athletes, hockey players, I guess.
Oh, yeah.
Yeah.
A lot of back
were the first patients to receive this treatment. And then in 1992, it was put on the market in the United States, and then that groundbreaking research in 94 by Ramos and Martin was put out.
Sure.
And then it took off from there. But this procedure actually overcomes the natural reflex muscle spasm that occurs when you simply try to stretch the body apart, creating a negative pressure gradient.
Sure.
The research shows a negative 160 millimeters of mercury is produced every time you undergo VAX-D only. This creates a vacuum, allowing for the natural retraction of fluid, nutrients, and oxygen back into that compressed spine. And really, that's the cause of the problem. The compression on the spine, the disc is being starved of nutrients. After the age of 25, there's no blood supply. So there's no way for that to regenerate itself. And when the spine is compressing, and this doesn't happen in one day, it happens over a period of months, if not years, the spine compresses. Sitting, standing, trauma, all the things we do to our body compresses the spine. And in many cases, this compression leads to accelerated degeneration, which leads to compression, which leads to bulging and herniation. So only VAX-D has been proven to actually create that negative pressure environment, that vacuum necessary to pull things back into the disc, pull the nutrients back in the disc, but also pull the disc that's herniated or bulging, contributing to your sciatica, your spinal stenosis, back into its original position and restore the health of the disc.
I love the way you phrased it. How you said somehow these guys were able to invent VAX-D therapy. And it just goes to show just where we're at right now with modern medicine. And what you guys are doing at American Back Center is bringing that modern medicine to the people, to anyone who has back pain.
It shows the innovation that is inherent with VAX-D. And if nothing else, when people think of their back pain, I mean, it really does change the way people think, does it not? I mean, when you think of, it used to be when you think of back pain, you think of something that would have to ultimately require surgery, or something that would just lay you out for a while, or downtime, or I'm going to miss a lot of work, or I'm going to miss a lot of family time, and miss all that stuff. This seems like it's a lot more, ironically, counter-ironically, cut and dry, right? Without having to cut, right?
Yeah, it's very safe, of course, non-invasive, FDA approved.
Sure.
Without any cutting. When they go in there with surgery, they have to rip out ligament, bone, and tissue. Every time they go in, typically just removing bone or disc that's necessary.
Sure.
So they're removing necessary parts, making the spine more unstable, not more stable, more unstable.
Right.
And then it's only a matter of time until the patient has problems again, and then they have to go back in for a subsequent surgery. I also want to make note, too, that VAX-D's come out with a new procedure now for the neck as well, so we also can treat disc problems in the cervical region as well.
So it really gets to more of the source of the problem. Surgery can cut and maybe be a fix for your pain here and now, but it sounds like VAX-D gets more to the source of the problem and really solves the overall issue, does it not?
Yeah, the source, really the cause of the problem. We talk about treating symptoms and treating the structural cause of the problem. We're actually treating the structural cause of the problem, not the symptoms. Unlike epidurals, pain meds, and so on, just treating the symptoms. A Band-Aid, right?
Right, yeah.
We're actually treating the structural cause of the problem.
So with VAX-D therapy, of course, there might be some hesitation amongst people. Oh, well, this is a unique kind of therapy to anything else, like going to a chiropractor or whatever. Is there going to be any sort of possible side effects? Walk people into the building and kind of ensure them that what you're doing is safe in that regard.
It's an extremely safe procedure. Again, it's non-invasive, non-surgical, FDA approved. The procedure itself, we do the necessary examination and looking for contraindications. In most cases, we require an MRI before we even consider putting you on the table.
Sure.
The MRI will show us the extent of the soft tissue damage. If you diagnose indicators like a bulging disc, herniated disc, indicators for the treatment, degenerative disc disease, spinal stenosis, and then, of course, rule out contraindications, reasons why we would potentially harm you.
Sure.
Those are few and far between, but we want to make sure, number one, no harm is done first, and then we look for reasons why the treatment could help you.
It sounds like there was a lot of working here for the patient in this regard. When you talk to people about this, a lot of what you do has to involve education, not just the actual procedure behind VAX-D, but you're educating people. You're taking a concept that a lot of people probably just don't even know and have to explain it to them. What sort of feedback do you get from people when you explain this to them for the first time?
Well, education is very, very important. And for example, too, when they start the program, structurally, we are working on the structural cause of the problem with the VAX-D. But also, we do incorporate therapy and rehab as well into the program as well, other modalities as well. And then we encourage the people, look at your ergonomics, look at how you're lifting, look how you're bending, look how you're doing things at home. And we look at the total picture to make sure this correction becomes a permanent correction, not a temporary fix.
So it's part and parcel of getting to the cause of everything, right? You're not just, this isn't just a make an appointment, get it done, see you, put you on your way. You're following people from their issue all the way through to the resolution of their whatever their situation may be because of your nature, right? The nature of all this is it's to really follow everything to make sure that at the end of the day, at the end of that path, they are back to where they were, if not better.
Yeah, I mean, we definitely want to do things right. We don't want the patient to have to keep coming back over and over, dealing with these issues. We want to make sure the patient, number one, is happy, pain-free, and able to live their life and enjoy their life.
Now, go a little further into detail in regards to the rehabilitation process, the post-vaccine process. How many times do you guys like to follow up with them, like each week, each month, something like that? And what does that rehabilitation look like?
I mean, they start the rehabilitation typically around the second, third week of the VAXD protocol. Our initial protocol with the VAXD is to stabilize the disc, get the inflammation, the acute inflammation under control. Once that's under control, because even very basic rehab could irritate in the beginning.
Right.
So we hold off on all that. We restrict their activities, just focus on the disc itself. And then later on, as things improve, we start incorporating the rehab to strengthen those weakened muscles, that core per se, to make sure that those everyday activities don't aggravate later on. And make it, as I mentioned before, a more permanent fix, not a temporary fix.
So, VAXD, American Back Centers, AmericanBackCenters.com. We're going to talk with Dr. Pete Peduzzi of American Back Centers. The number, once again, is 724-935-3300. If I am listening to the show right now and I have a back issue, or I know someone who has a back issue, and I refer them to that number, what is going to happen? Walk us through that process. When somebody calls 724-935-3300, when somebody logs on to AmericanBackCenters.com, what is the process? How do you engage with that person?
So we're definitely going to schedule you for a consultation with myself. Once you come in, we're going to ask you, if you can, to make sure you bring all your material with you, your medical records. If you can obtain your MRI, you can have it faxed over or emailed over, bring it with you as well. So we have all the material to make a good decision to see if you are a candidate for this procedure.
Because it's a time thing, too. You don't want your time wasted. You don't want to waste the time of the patient. Either time is invaluable.
And many people don't have that either. They're just starting from the beginning, potentially. So if that's the case, too, following a detailed physical exam and history, we may determine that you need an MRI or X-ray. We can do the X-rays in the office. And we have a very convenient MRI facility right across the street from our office.
Oh, very
very
nice.
Convenient, yeah.
So, as we said earlier, this is for really anybody with a back issue, right? If you're thinking about maybe back surgery, VAXD, right? VAXD is where it's at. If you think about back surgery, call you first, right? Get that second opinion.
I mean, really, the real question is, why would you even consider spinal surgery with all the potential permanent complications and all the lack of success when you have something successful, very safe, FDA approved, non-invasive is what we offer with VAXD.
Sure. Well, just about ready to wrap up here. Any final words of wisdom for our audience?
Well, I mean, don't wait. We've seen some of the most difficult cases. People have been to every doctor known to man. Of course, we prefer if we see you before that, of course. But don't wait until your condition worsens. Call us today. We can help you with your back or neck pain.
As I say, there's no such thing as too soon, but there could very well be a too late, right?
Oh, most certainly. I mean, in some cases, the longer you wait, there's more complicating factors. But again, we've seen some of the most difficult cases where they've been every doctor known to man. But definitely, the longer you wait, your prognosis could be slightly less because now you have more complicating factors.
You heard him, Dr. Pete Peduzzi, American Back Centers, AmericanBackCenters.com, 724-935-3300. Call that number if you're even thinking about your back issues. If you're not even sure where to start, you got something going on, you're not really sure what's up with it, you're not sure if it's something that could be a problem down the road, if it's bothering you right now, there's no such thing as too soon. There's only too late. Pete, thank you so much for joining us here on the GD Morning Show.
Thanks, Pete.
Well, thanks for having me, guys.
Talking Pittsburgh, 1320 WJAS. Back with more after this from the Ireland Contracting Studio. Stay close.